Well, continuing the conversation about autism with Dr. Jennifer Morris with the Moore Autism Center. Like you said, at first you were a little skeptical of this show, but you changed your mind. Before we get there, let's talk just real basics. Tell us about what is autism.
So autism is a neurodevelopmental disorder, basically meaning that it starts early in life where children start to have developmental delays, and their main difficulties are in reciprocal social interaction and communication, and they also have restricted interests and repetitive behaviors. So kind of both categories come up in children with autism.
And in many cases, probably with children or adults in our daily lives, we're probably meeting with people with autism that we don't necessarily know right away, but we may know we notice something, but we may not know it's autism.
Absolutely. I think for a long time it was, the quirky people that we interacted with on a daily basis, and so now we're able to identify earlier when, there might be more difficulties, or on the more severe end, kids that are not speaking, and how we can work with them from a very early age to start developing those skills.
We know the statistic 1 in 68 children will be diagnosed with autism. Are we seeing more cases of autism?
The rates have been looking more severe over time, where we have this 1 in 68. When I started working with autism, it was 1 in 110. Basically, our diagnostic tools are improving, so we're getting better at identifying what autism is and being able to say it's this and not something else, so like an intellectual delay or some other like social anxiety or some other difficulty. So we're better able to identify it. They're still doing a lot of research to figure out why the rates are increasing so much, but I think awareness is a big part of it. A lot of people are much more aware of what autism is, and they're paying attention and identifying things at an earlier age.
What did you think of the show, The Good Doctor?
I think it's a really interesting show because it shows sort of a person with autism in a setting that, we've seen a lot of shows about medical professions, but to see what somebody with autism would be like in that profession. Especially this week's episode, I noticed that they did a lot with how it is to communicate with someone with autism. Sometimes, you say something to them and they don't respond. And it doesn't necessarily mean they didn't hear you or that they didn't understand you. They just are thinking about something else, or their mind is somewhere else. And so I think they're doing a good job of showing some of the everyday difficulties that people with autism face.
Yeah, talk about that, because you see patients, children, all the way into adulthood. So you're seeing some of these things, and you think the show is doing a good job at helping illustrate that.
I think it is. I think that they're taking specific areas of autism and focusing on those. So like, asking questions. The individual on the show, he said, I don't like questions. And that's something I've heard from many, many people with autism, that it's just uncomfortable for them to be asked a lot of questions. Another thing last night's episode showed was the repetitive movements. When he became overwhelmed, he began rocking and head banging, which is something that we see more in individuals with autism. And so I think that they're showing that it's maybe not something that happens all the time with people with autism, but in extreme situations, sometimes these behaviors will come out. And so I think they're doing a good job of sharing some of those pieces of autism with the broader culture.
What could the show do better? I guess with this person's case, they are, like you said, they have autism, but also savant syndrome. So this is one side of the spectrum. Something the show could do better?
I think just considering that autism is a wide spectrum, to where there are a lot of individuals with autism who have intellectual delays, severe communication delays, who don't speak, or who have to use communication devices to speak. So recognizing that while he is on the spectrum, there is a very wide range there, and considering that there are a lot of other individuals who may not look just like him, but also have that diagnosis of autism.
What do you hope comes out of a show like this for people that are watching this for the first time, maybe their first real look into somebody that has autism? What do you hope happens in our community, or for people that are watching this?
I hope it just continues to promote dialogue and understanding of individuals that might be different from us, so that these individuals can, have jobs, go to the grocery store, live everyday lives, and, not be given such harsh views if they have a meltdown in the middle of the store, or if they don't respond immediately and aren't just immediately viewed as, oh, that rude person or that really inconsiderate person, when it really may be this underlying issue of autism going on. So I think that it helps promote that understanding to people people.
Helping to make us all aware and to
Yes.
take time and be present with who we are interacting with.
Yes.
All right, Dr. Jennifer Morris,
Thank
I'll
you.
shake your hand here. Thank you for coming out this morning. We appreciate it.